Poso maoni wiak, waiwanan kitanan ni mua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman e ne hisikimaka e yoso matnamin e hakihi.
Welcome to the Nominee Indian Tribe of Wisconsin podcast. I'm your host, Sheena Wapus. On this episode, we are joined by Vaughn Bowles, Public Information Officer for the Nominee Indian Tribe of Wisconsin. I would like to remind everyone, we request you send in your COVID-19 related questions to us at podcast@mitw.org. Welcome, Vaughn.
Hi, Sheena.
So, Vaughn, I've seen this question come up quite a few times. Does the tribe have plans to vaccinate teens in the future?
So it really depends on CDC recommendations and what gets approved by the U.S. government. Right now, Moderna and Pfizer are both testing their vaccines on younger individuals. They're farther along in their studies for individuals that are between the ages of 12 and 15. But they've also started trials on individuals as young as 6 months. So when those conclude, we'll have more information on that. Moderna is looking to enroll about 6,700 individuals into their particular study. That'll be across 8 different states and in parts of Canada. Pfizer is looking to enroll just over 2,000 individuals in their particular study. So once they conclude those, we'll have a better idea of if we'll be able to vaccinate our teens. We would like to be able to vaccinate the entire population, to ensure herd immunity. So if we're allowed to, we probably will in the future, yeah.
So if we have parents that are now fully vaccinated and obviously their children aren't, are they allowed to visit other families who are also just have vaccinated parents?
So the CDC there's kind of some gray areas about that because the CDC says that you can gather indoors with fully vaccinated people without wearing masks. They also say that you can gather indoors with unvaccinated people from one other household, like a family or relative, without masks, unless those people are at increased risk for severe COVID cases. Currently, because they're not vaccinating youth, they don't have anything in their protocols mentioned, but they've also released reports stating that children are less likely to spread the virus, which is why they've come out with a couple different reports that talk about it's okay to have in-person school again. This one of the studies that the major study was actually conducted here in Wisconsin. We can put a link to that study in the show notes if anyone would like to go look that up. But right now, it should be okay to visit those people if, all of the adults have been vaccinated.
So does that mean that we can have children's birthday parties indoors?
I hate to be the person that says yes, but I'm going to say use caution and prudence. Maybe if it's with one other family like they've talked about, if it's not a huge gathering, they're still recommending that, we avoid, medium to large size gatherings. I know some people, when they have a child's birthday party, it turns into a huge event. I totally understand. I'm from a big family. So, use your judgment on that one.
So can people safely travel after they've been fully vaccinated?
CDC is still asking people to delay travel if possible because it puts them at a higher risk of contracting and spreading COVID. That said, you are safer if you are vaccinated. They do have some recommendations for travel, though. First is they want you to get tested, 1 to 3 days before your trip, so whether or not you're taking it with you. They also ask you to, wear the masks, avoid crowds, wash your hands frequently, and use hand sanitizer with at least 60 to 70% alcohol if you have it. They encourage bringing extra supplies like hand sanitizer, mask, and non-perishable foods so you can limit your interaction with other people while you're traveling. And then when you return home, they recommend you get it tested 3 to 5 days afterwards. and self-quarantine just to make sure you don't have it and are passing it to individuals once you get back. They say if you don't get tested upon return, they do recommend self-quarantine for 10 days after travel. So technically you could. There's not a ban on it. They're just kind of discouraging it still. So it's up to you.
If the tribe reaches quote-unquote herd immunity as a community, will we continue to have a mask mandate?
So I'm only one of the voices on the IC team, and my personal opinion is that, if the vaccine works as well as they say, it doesn't make a lot of sense to keep the mask mandate in place if we truly do have herd immunity. That said, the CDC is recommending that even when you are vaccinated to continue taking precautions, because even though we may reach a point where we have, say, 80% of the individuals on the reservation in the county vaccinated, it still doesn't account for Shawano County, Oconto County, the surrounding areas and stuff where they haven't been able to keep up with the vaccinations quite as well as the tribe has. So they still recommend, wearing masks, staying 6 feet apart and avoiding crowds, and avoiding time in poorly ventilated areas like cars with people. And just to give a brief update on how we're doing with our vaccination efforts and stuff locally, we've been able to give out 4,300 doses at this point. We've vaccinated 39% of the Menominee County residents. They've had at least one dose. 21% will have both completed. So we're doing really well as far as getting the vaccination out. That number will increase as far as who's had 2 doses by about 500 doses by the end of next week. So that's a decent amount of our population. We've got about 87% of our individuals that are 65 and older that have had at least 1 dose. 71% of our 55 and older have had at least 1 dose, and 52% of our 35 to 45 have gotten at least 1 dose. But the goal, again, is to get at least 80% of the population vaccinated with 2 doses at least. Some of the things that are being discussed right now is a mobile vaccine team that'll be in Neopit. That looks like it'll be on April 9th. And we'll get the message out when we have more of the details. We're also looking at another vaccine clinic, like extended hours on like April 8th. Again, we'll have more details when those come up. And we're looking to put together a small mobile team that can head to the South Branch area. Again, we'll update everyone more when those details are forthcoming.
So, what would you say to someone who's experienced side effects from getting the first dose of the vaccine is now considering not getting the second dose because they felt so crappy after the first dose?
The first thing I'd say is, talk to your doctor, and really ask whether or not your reaction needs to be reported to VAERS, the Vaccine Adverse Event Reporting System. Because if you're having an event, the makers of the vaccine and the government, the CDC, they need to know about those things to help track whether or not it's safe. And in that discussion, you can also, talk about whether it's safe for you to go on with the second vaccine or if you should discontinue it. But again, that's a discussion you should have with your healthcare provider.
Do we know more about the long-term effects of COVID at this point?
So when we're talking long-term, in the medical profession, you're usually looking out past at least 1 year, up to 10 years in some cases. Because COVID's relatively new, we're still trying to gather as much information as we can on the long-term effects. Some patients can have symptoms that last, for weeks or months after they've gotten rid of their acute illness. We do know that. But the CDC is continuing to work on how common long-term symptoms are, who's most likely to get them, and what some of these symptoms are, and if they're going to resolve. One of the reasons that they think specific long-term effects occur, though, is because COVID doesn't act like some of the other pathogens out there that cause things like pneumonia. It really overstimulates the immune system, and so they've found so far that it damages multiple organ systems. And when that happens, they've found that there are, specific long-term effects. The common ones include fatigue and shortness of breath. You could have a cough long-term, or joint pain or chest pain. Other long-term, side effects that you might experience include things like difficulty thinking or concentrating. They actually call this brain fog. Some people experience depression associated with this. There's muscle pains, headaches. You could have intermittent fevers, or you could have heart palpitations, which is when your heart beats too fast. There are a series of less common but more serious types of long-term side effects. These include things like inflammation of the heart or the cardiovascular system. They also found long-term respiratory or lung abnormalities. They've found that people can also have acute renal or kidney injuries. There are dermatological changes that can take place. Some people experience long-term rashes or hair loss. Some people experience a long-term loss of their smell or their taste. They've also identified sleep issues and psychological impacts like depression or anxiety or mood swings. So there's a wide array of things that could happen, and they're still trying to track down how common that is. And because there is such a wide array of long-term effects, that's part of the reason we're so adamant about trying to push the vaccination to the population and encourage people to get that, because these are life-altering right now as far as we know. We don't know if they'll resolve. And so, we would rather inconvenience you with a little bit of time and, a shot to the arm or two than have you experience some of these things. And if you'd like more information on them, we can post links to both the CDC and the Mayo Clinic on some of these long-term issues that are out there.
So if you've already had COVID and recovered, should you still get the vaccine?
It's encouraged at this point because, just like the long-term effects, we're still studying how long a person retains their innate immunity following infection. So right now they're encouraging even people that have gotten COVID to get a vaccination as well.
I have an off-the-cuff question.
Yeah, go for it.
I don't
Bring
know
it
if you
on.
know or not anything about it, but I have heard or read a couple places that people can have more severe side effects from the vaccine if they've already had COVID. Do you know anything about that?
I've heard similar things to that effect. The reason for it is the immune system essentially launches an immune response against the vaccine the first time around. And so, yeah, they can experience, some hefty side effects along with that, or, flu-like, COVID-like symptoms from getting the vaccine. So I would, say yes, I've heard that as well. I don't have any show notes or reports on that, but yeah, I've read that too.
Okay, will COVID be like the flu in that every year we have new strains and that we need to get vaccinated every year?
Because it's technically a coronavirus, it'd be more like the seasonal cold rather than the seasonal flu. But it may be something that we need to get vaccinated on in succession. And that'd be due to, the virus's ability to mutate and cause novel variants or new strains. There have been some interesting studies that have come out. One came from the University of Glasgow this week that indicated that having the common cold this year, or any other year essentially, could actually help your body stimulate fighting off a COVID infection. And so, we may need more vaccinations down the road, may not, because it's fairly similar to some other diseases out there. We'll have to see what the studies say.
You have anything else to say for people this week?
For those of you that have taken the time to go out to get vaccinated, we really appreciate the effort. For those of you that haven't yet, we'd really strongly encourage you to do so. We're trying to accommodate everyone we can, and we really want you to stay healthy and safe.
And for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the Community tab, and keep up to date by following us on Facebook at MITW Podcast. We do weekly updates with Vaughn and welcome any community questions you have regarding COVID-19. Please send them to us via email at podcast@mitw.org.